ankylosing spondylitis. And so I wanted to review what that is and what you can do about it, because it can be a challenge and a struggle and tough to treat. So let's just kind of start talking about this. And I think there's some good pearls for lots of healthcare conditions for ankylosing spondylitis, because it's in the autoimmune family. And what happens is a lot of times people come in with chronic back pain. Usually that's where you find it, in the sacroiliac joint in the pelvis or in the spine. And what happens is the ligaments stop to be flexible. And so they start to fuse. And so what happens is an x-ray, they call it a bamboo spine. You'll see the fusions of the lateral part of the disc, or and you'll just see this big fusion that occurs. Usually the sacroiliac joints start to get really white, which means there's a lot of metabolic activity, and they start to fuse together. But if you can imagine a joint that's supposed to move, and the muscles are supposed to move the joint, and if the joint is fused, what does that do to the muscles? So literally it's like going up to a wall, putting your hand against the wall, and then pushing as hard as you can. And then of course the wall never moves. And so that is what happens with ankylosing spondylitis. It's an inflammatory arthritis. And one of the most important things, if there's a concern of having, it's relatively rare. Like the most important thing is you've got to be active and move. Well, this is a good recommendation for health anyway, whether it's Lyme disease, neurodegenerative disease, wanting to be healthy, cancer prevention, like all of that. I think it all benefits from movement. Movement is life. So ankylosing spondylitis is an advanced arthritis where the ligaments, which stabilize the bones, they literally turn into a hard bony structure, and then the joint literally can't move. Happens a little bit more in males than females. And the medical idea, or the medical thing, says that it's untreatable. Like you can't do anything about it. You can manage symptoms. You don't get better. Well, I don't believe that. You've seen it in one of our star patient success stories with Casey, and Casey beating ankylosing spondylitis. You usually get some of the signs where you get a lot of stiffness and stuff in the morning, a lot of pain across the dull, achy pain across the belt line and in the hip area, sometimes in the neck. And then in the advanced portions of it, what happens is the rib connective tissue starts to fuse, and it makes it difficult to breathe. And so we want to institute an aggressive intervention as soon as possible. Movement, massage therapy, physical therapy, I think is excellent. Chiropractic therapy to make sure that joint's moving. And then what I think causes it, and I was going to say this a little bit later out of the presentation, but what causes it is an infection in the ligament. And then as the immune system comes in to try and contain it, it's almost like the same white lesions that occur on multiple sclerosis. The body's trying to contain that infection on the nerve. And in ankylosing spondylitis is just a different problem. It's a fusion of the joints. You got to help the immune system to clean up that infection. Okay, let's see. One of the best ways to test for it, number one, is an x-ray. Number two, there's a blood test marker called HLA-B27, and the team seems to increase in ankylosing spondylitis. And again, the body's forming bone where it's not supposed to be. So that's the other thing that's really important, is to making sure your calcium metabolism, calcium in the wrong place causes a lot of problems, cataracts, bursitis, osteoarthritis. You can make an argument that it's in the wrong place for ankylosing spondylitis. Not having enough calcium, osteoporosis, spontaneous fractures, weak, rigid nails, hair falling out, low immune system. So calcium, like blood sugar, too high, you got diabetes, too low, you got hypoglycemia. They're both really bad. You just want it to be balanced. So we're looking at what is the payload of calcium. Is the patient getting too much calcium, and are we absorbing too much of it, which that's called hypervitaminosis D and hypervitaminosis F. So F is good if you have a little bit, but too much linoleic and linolenic acid that comes typically from seed oils. What happens is it takes the calcium and it drives it into the tissues. So this is one of those cases where you got to be really careful with your driver. You don't want to drive too much calcium into that area. Some complications with ankylosing spondylitis uveitis, compression fractures, heart problems, diagnosis. You'll see people that don't have very good range of motion. Typically you pick it up in x-rays and you can do a genetic test. And then the mainstream treatment for it is an anti-inflammatory and some type of TNF inhibitor. Probably the most common one is Humira. And then I think physical therapy really excels in conditions like this. I highly recommend it, working with a physical therapist to increase movement patterns and make people have better range of motion, exercise program. And then what I tell people is you cannot be a couch potato with ankylosing spondylitis. You got to move constantly. So in addition to those recommendations, what I like to do is the magic treatment of some IV DMSO. It's essentially refined tree sap. What refined tree sap does, it's a universal softener. It's really, really good for hardened tissue. And then I'm going to post a link later to Casey's story. So that's a real quick little overview of ankylosing spondylitis. There's a lot of review with autoimmune disorders because it's the same process, whether it's multiple sclerosis, rheumatoid arthritis, Sjogren's disease, ankylosing spondylitis, lupus, is we want to figure out what's the trigger. How can we help remove the trigger? Working on your energy pathways. A lot of energy work is really good for autoimmune disorders. So you want to see, is there some type of unresolved emotion, abuse, difficult business or family relationship that we want to improve the energy around, and then using things to help the immune system to be more efficient.